Hi, Jennifer. My name is Susan, and I am the nurse in charge here at the emergency department. I heard you wanted to see me. So, tell me, what can I do for you today?
Yes, nurse. I was told that I will need a blood transfusion, and I am really scared of it.
Thank you for sharing that with me, Jennifer. It's completely understandable to feel scared, especially if this is your first time needing a blood transfusion. It's a big step, and it's natural to have concerns. Would you mind telling me a bit more about what specifically is making you feel anxious? That way, I can address any worries you have and make sure you're as comfortable as possible.
Well, I've heard stories about people contracting HIV through blood transfusions, and I'm terrified that something like that could happen to me.
Jennifer, I really appreciate you being open with me about your concerns. You're absolutely right that, in the past, there were instances where infections like HIV were transmitted through blood transfusions. However, I want to reassure you that those days are far behind us. Modern medical practices have made significant advancements, and we now have extremely stringent protocols in place to ensure the safety of blood transfusions. Every single blood donor undergoes a rigorous screening process to rule out any risk factors, and the donated blood is meticulously tested for viruses, including HIV, before it can be used. This process drastically reduces the risk of any infection to an extremely low level. While no medical procedure is entirely without risk, I can assure you that we take every possible precaution to protect your health. Does that help ease some of your worries?
Yes, it does. But I'm also nervous because I don't really know what the procedure involves. Could you explain it to me so I know what to expect?
Of course, Jennifer. I'm glad you asked, because understanding what's going to happen can really help reduce anxiety. So, let me walk you through it step by step. When it's time for the transfusion, the first thing we do is ensure everything is completely sterile. This means all our equipment, from the medical bags that store the blood to the intravenous IV, lines, and needles, is sanitized and handled in a way that keeps you safe from infection. We'll connect a bag of the donor blood to an IV line, which is a thin, flexible tube. This IV line will be inserted into a vein in your arm or hand using a sterile needle. You might feel a small prick when the needle goes in, but it's usually just a momentary discomfort.
That doesn't sound too bad. But what happens once the needle is in?
Good question. Once the needle is in place and the IV is set up, the blood will begin to flow slowly from the bag into your bloodstream. We do this at a controlled rate to ensure your body adjusts smoothly to the new blood. Throughout the entire procedure, which usually takes a couple of hours depending on how much blood you need, I will be by your side, monitoring your vital signs closely. Things like your heart rate, blood pressure, and oxygen levels. We'll be watching to make sure everything is progressing smoothly, and if at any point you feel uncomfortable or notice anything unusual, you just need to let us know, and we'll address it immediately. It's a very safe process, but we're always here to support you and ensure you feel as comfortable as possible.
That definitely helps me understand better. But I'm still a little bit afraid, to be honest. Is there any other way to avoid needing a blood transfusion?
Jennifer, it's perfectly okay to feel the way you do. Fear is a normal response when facing something unfamiliar, especially when it involves your health. However, in your case, after reviewing your situation, I can tell you that a blood transfusion really is the best option. You've lost a significant amount of blood in the accident, and replacing that lost blood is crucial for your recovery. It will help restore your blood volume, improve circulation, and ensure your organs receive the oxygen they need to function properly. Without it, your recovery could be much slower, and you might experience complications that we can prevent by giving you the transfusion now. I truly believe that this is the best and safest course of action for you. After hearing this, does it make you feel a bit more reassured about moving forward with the transfusion?
Yes, I do feel more comfortable with the idea now. Thank you for taking the time to explain everything so clearly.
I'm really glad to hear that, Jennifer. It's important to us that you feel supported and informed every step of the way. Now, the next step is to have you sign the patient consent form. This form is simply an acknowledgement that you understand the procedure and agree to move forward with it. I'll call the doctor in to go over the final details with you, and then we can get started. After you sign the consent, I'll establish an IV access and double-check your identification to ensure everything matches up correctly. Do I have your permission to bring the doctor in so we can proceed?
Yes, you do. I'm ready.
Thank you, Jennifer. I'll be back in just a moment with the doctor. In the meantime, if you have any last-minute questions or concerns, please don't hesitate to bring them up. We're here for you, every step of the way.
Thank you, nurse. I really appreciate it.
It's my pleasure, Jennifer. I'll be right back with the doctor. You're doing great, and we'll take excellent care of you. Just sit tight for a moment.